Welcome to our Public Safety for All informational series. Today, we will be discussing alternative response models. With us, we are honored to have Ms. Stephanie Guirand. And if you'll give me 1 second here. And we will be discussing alternative public safety response models in a little bit more detail for everyone as a foundational awareness piece to our initiative for public safety for all. The informational series is in order to raise awareness of the current public safety efforts happening in the city of Somerville, the city leadership who help provide public safety services, and to learn about public safety response models. In this session, we will learn specifically more about alternative public safety response models and structures. And as we come to a close, we will have the opportunity to learn more about some examples of these programs locally and nationally. You will also have an opportunity to ask questions throughout the presentation. So please use the Q&A feature in order to ask your questions, and I will do my best to field those questions and ask our honored guest here this evening the question that you have for her. So as we all join this space to learn and become more aware of public safety models, we ask that you please honor the following community norms. Please speak your truth and use I statements. Respect everyone's opinions. Listen with an open mind and heart, and expect and accept non-closure. Also, we will be holding space for parking lot items if we feel that it's a longer discussion, and we are happy to address it later. Tonight, Stephanie Guirand will lead us in this conversation around alternative public safety response models. Stephanie is a founding member of the Black Response Cambridge that designed and facilitated the participatory action process for developing the Cambridge Holistic Emergency Alternative Response Team, also known as HEART model. Stephanie holds a bachelor's degree from the University of Connecticut, a master's degree from the University of London, an SOAS in a joint program with the London School of Economics, and is currently a PhD candidate at Goldsmiths University of London in the sociology department. As if this isn't enough, Stephanie currently works as a senior researcher for Community Service Care, Inc. for the Black Response Cambridge. Her work there explores the landscapes of police and behavioral health alternatives. She is formerly an immigrant. Well, she's always going to be Haitian, but she is formerly an immigrant from Haiti and has lived in Cambridge, Massachusetts for over 25 years. We would like to welcome Stephanie this evening, and we are super honored to have her and her wisdom and expertise with us this evening. Thank you, Stephanie, for joining us. So, Stephanie, I know that you have a presentation for us, and I think I would like to start off with the first question, and then you can just lead into your presentation. And as we get questions from our constituents, I will gently and kindly find the perfect space to interrupt and ask you the questions as it's still relative to the slide that you're on. But I don't know if you want to say a few words before I ask my first question.
No, let's just jump into it.
All right, we got a lot to do tonight. So first, what are some of the biggest challenges or barriers you have seen come up in creating alternative response models?
All right, so I think I'll address that question and in general, models and structures throughout my presentation.
Okay, yeah. Let's do it.
All right. All right. Can you all see my screen? Excellent. Okay. So as Somerville policymakers, both legislators and community members undergo the process of designing an alternative to the existing community safety systems locally, I've prepared this presentation with some information that you all might consider as we move forward. Before I begin, please keep in mind that this presentation will zoom out to talk about the landscapes of alternatives broadly. That is, I will name organizations around the country that you might take a closer look at as you develop your local initiative. And just the same, I'll zoom in. I'll look at some specific emergency calls a model might be able to take on and which agencies within the city or community are best suited to house it. Lastly, I'll be talking about models of alternatives. I will present 4 models. Please know that there are 4 more models to consider, and the models I'll present here all exist and are housed within organizations around the United States and Canada. I'll highlight some changes that could be made to each model to address particular problems locally. I'll also detail the structures of existing models, including their aims and implementation styles. I won't use any one organization as an example, but rather we'll look at how organizations have employed models towards specific aims. Throughout the presentation, I'll refer to activities of models as an intervention. I use this term to mean the action or process of interrupting a problem, like poverty or violence. Also, throughout the presentation, I'll drop some links, I hope, to external documents in the chat. So feel free to save these links and to review them after the presentation. These links will give you further information about an idea or a model that I've named. Okay, so let's begin. In this presentation, I'll present 4 models. They are the hub model, violence interrupter models, mobile crisis response, and targeted population models. Right. Before we hop into the models, I think it makes some sense to deconstruct what models, the models to see what we are looking for. So the first thing we need to consider is the temporal point of intervention. That is, when the intervention is taking place. Will the model focus on prevention efforts, that is, before a conflict, crisis, or violence takes place? Will the model focus on immediate response, that is, as the crisis or conflict or violence is taking place? Or will the model focus on aftercare, that is, checking up on people after conflict, crisis, or violence? The second thing to consider is who is coordinating the intervention. Will the model be community-led, police-led, service provider-led? I use this term service provider very loosely here. It refers to organizations that facilitate the distribution of goods and services, such as housing, food, emotional, or administrative support. Examples include homeless services, such as the Somerville Homeless Coalition, or food services, such as community cooks. Most responses to conflict, crisis, or violence are hybrid. That is, they may involve the police as a first responder, for example, and a secondary response that might be a service provider. For example, the police might respond to a domestic violence call as the first responders. They may involve a nonprofit domestic violence agency to case manage aftercare. The domestic violence agency is a second responder here. This is an example of a hybrid intervention. Just the same, someone might go straight to a domestic violence agency who could help find someone housing through a housing agency, another hybrid intervention. With hybrid intervention, it's essential to consider the impacts of the structure of the relationship between 2 or more entities, the method of accountability, and the design of the intervention itself. So these are some of the things that we're going to consider throughout the presentation. Right. A third thing to consider is who is being served by the intervention. I've compiled a list on screen of some target populations. This list includes youth, people who survive poverty in public, substance users, and more. I just want to take some time to have you guys see this preliminary list. We'll talk about a larger list later on. Another thing to consider, and I really encourage you all to take a look at this book. It's called Administrative Burden by Pamela Hurd and Donald Moynihan, they caution us with the following. So means-tested programs, that is, programs conditional on financial status, must do more to distinguish between eligibility, the eligible and ineligible. But in creating administrative processes to do so, they add more burdens to the government and to the citizens. They also caution us with administrative burdens are distributive. They affect some groups more than others, and in doing so, often reinforce inequalities. The least advantaged tend to have the most administrative burden. And lastly, broadly accessible programs can reach more people and therefore be more likely to achieve policy goals. That is, non-means tested programs are accessible to people of all incomes and background and have higher take-up rates. So as Somerville moves forward with developing a community safety initiative, you all need to heed these cautions by designing a program accordingly. How can Somerville create an alternative public safety program that doesn't create administrative burdens, such as proof of income or proof of residency requirements? These will have low take-up rates and low use rates among the very populations that are in most needs of assistance. All right. The first model I will look at is the hub model. The hub model is also known as the situation table. It is a multi-tiered partnership model focused on proactively reaching out to people in need of support and mobilizing the resources offered by service providers. It requires a convener of a table. The convener is responsible for administrative work of bringing service providers to a table, facilitating a process for protocol development for working together, keeping and collecting data on case types, and distributing resources to service providers. One of the administrative responsibilities then is to make sure that the representatives from each service provider signs and adheres to a confidentiality agreement for liability purposes. For instance, I'm a member of the Black Response, and I can share that the coalition that developed the Cambridge Heart model envisions facilitating a hub-type model where the service providers remain at their respective locations and community responders based at Heart perform the aftercare and other supportive interventions. Some places that employ this model include Boston, Massachusetts, Ithaca, New York, Saskatoon in Saskatchewan, Canada, where this model originated. Please note that this model has since become very popular, and there are ever-growing numbers of cities and communities that employ this version of this model. And depending on how the model is designed, the cases can be brought to the table from different sources. And over the next few slides, I'll introduce the structure in further detail. Let me drop this link into the chat. You can learn more about the model. Right. As the hub model needs a convener, there are three potential conveners for the model. The convener can be a community convener, a police convener, or a service provider-based convener. In this slide, I'll focus on the community-led approach. With the hub model and the community-led approach in particular, there's the question of which community or communities are being supported by the intervention. I've offered three potential communities here. Of course, y'all can consider more. There are language-speaking communities, neighborhoods or geographic communities, religious communities, again. Of course, there are a number of different types of communities, and you have to determine which communities this program that you're designing will target for its interventions. Another crucial component of the hub model is the convener. So who will coordinate the table? Who will hold the convening? Again, I've offered some potential options: street workers, religious leaders, community leaders, neighbors, activists, others, of course. In terms of roles, the hub model has three: the convener, the responder, and the services. So we've covered the convener. So who are the responders? Again, they could be the street workers, religious leaders, community members, neighbors. what are they responding to? I've included a list of potential emergency calls that could be directed to alternatives on this slide. And I propose a community-led hub model would allocate calls, including preventative care and follow-up care, domestic violence, post-conflict, conflict mediation, wellness checks, and mutual aid support. And of course, there's more. At the end of the presentation, I'll drop another link in the chat with a longer list. And you have to consider, again, the temporal point of intervention. When will they perform the intervention? Will they do preventative efforts? Will they respond at the time of an emergency, or will they follow up? This model is excellent for aftercare, but can be designed to innovate for immediate response and prevention. All right. And this slide will focus on the police-led response. The same questions from the community-led response apply to the police-led response models. And in the police-led response models, there's a question of the location of the response to consider. Will this intervention take place within jails and prisons, or will they take place outside of jails and prisons? When the police lead a jail-based intervention, they focus on three things: pre-trial services, in-custody assessments, treatments, and/or support, community re-entry, discharge planning. In jail-based intervention, there's still this question of who they are responding to. Is it simply responding to the formerly incarcerated individuals, or are they also prepared to support the families in the larger communities for the release of certain individuals? For example, if someone convicted of as a child sex offender is released from prison, who's responsible for supporting the family of the child against whom the sexual violence was committed? Is that the intervention, or is it supporting the formerly incarcerated individual with finding housing in a permitted area, i.e. not with a relative who may be exposed to children? Or is the intervention both, perhaps? On the other hand, there's still the option of the police-based response outside of jails, that is in the city. For example, Boston University professor Spencer Piston makes this point that police-led interventions may or may not connect someone to existing services of some kind, i.e. escort an unhoused person to a shelter, but they are most often actually serving the caller, the business owner, the homeowner, etc. The temporal point of intervention is important to consider. Again, when is the intervention taking place? Is the police-led intervention responding to immediate violence, imminent violence, or immediate violence? Or again, are they responding to community needs after the fact? There's some very important factors to consider with police-led interventions. First, if the police are leading it, it cannot be considered an alternative to policing. It's just a new program under the purview of the police. Second, having police facilitate certain responses can prevent access to certain populations, i.e. Undocumented people, members of gangs, etc. So if the intervention is designed to address specific issues within hard-to-reach populations, you need to accept that the police are not necessarily the best fit for reaching certain populations. And third, the interventions proposed here do not require a gun. And in some cases, a badge and a gun may hinder the ability to properly respond to a case. For example, people with histories of trauma or people in crisis. And their training, that is police training, which includes weapons, use of force, legal education, is likely to inhibit the skills they need for a successful intervention. I'm going to drop a link in the chat with information about police training. Maybe I am. Yes, I am. Okay. All right. Next slide. The final model is the service provider-led intervention. Again, everything done by the community-led response and the police-led response can also be done by a service provider-led response. Some things to consider are there can be a convener that is housed within the city government or within a service provider nonprofit. The convener is an administrative position. The responders, however, can be trained community members or contracted response team through a community organization that is a nonprofit, right? Again, if the police are facilitating the intervention, this is not an alternative to police. It's just the police. Where the intervention is located and the convener is located really matters in this discussion. The initiative can be facilitated within a city department or within a nonprofit service provider. What are some good services to consider including in your hub table? I've made this document. It's sort of an everything document, but it has a list of service provider types to include in your hub table. I'll drop that in the chat. All right. They include continuums of care services such as shelters, SRO, public housing agencies, and more. Food and mutual aid organizations, material aid, financial aid, legal aid, transportation or people power. Funding options, again, mutual aid, local foundations. Legal services tend to be a very important one. So consider bringing in the ACLU or the National Lawyers Guild, Harvard Legal Aid, and other legal aid services. What can a service provider-led hub model respond to? Again, it's very similar to all of the other hub models. Domestic violence, they are able to mediate conflicts and do wellness checks and noise complaints. A mutual aid crisis, of course. They can also intervene in trespassing and conflicts between and among unhoused populations. During the question and answer session or in the box, please ask how to account for or if a situation turns violent or seemingly violent beyond the capacity of a non-police responder. I think it's a very important question to answer. Right. Next model, mobile crisis response. The mobile crisis response model has many names. Of course, it could be the mobile crisis response team or the mobile crisis rapid response team, alternative emergency response team, and even crisis intervention team, which is a very specific name, but it fits here. In general, a mobile crisis response model is one that services the community by providing a response to specific, primarily behavioral health needs and emergencies. However, depending on whether it's housed within a city department or a government affiliated or contracted nonprofit or an independent community organization, a mobile crisis response program may have a range of services and clients. These programs can narrowly focus on mental or behavioral health. However, there are many intersectional issues that need to be considered. For example, if you have a program that services the unhoused and one that services people in crisis, which one would respond to an unhoused community member who's experiencing a crisis? And just the same for someone who experiences a substance-related crisis, and so on. So there are many intersectional issues. Because of the range of intersectional factors, I've classified mobile crisis response as a separate model type. There are a number of different mobile crisis response programs. The most prominent is the CAHOOTS program in Eugene and Springfield, Oregon. It operates as a mobile crisis response program as contracted nonprofit organization. Denver, Colorado has the STAR program that operates as a mobile crisis response program embedded in the Department of Public Health. The Macro program in Oakland operates as a mobile crisis response program embedded in the city's fire department. The Mental Health First program in Sacramento, California operates a warm line and dispatches crisis response. They're entirely autonomous from city agencies. Okay. So there are two types of mobile crisis response programs. This might seem a little contrary, but there's a mobile crisis response and the stationary mobile crisis response. And for the mobile response, the team would need to receive a call. A responder team would need to be dispatched to a location. The response team would de-escalate the immediate crisis and create a short-term safety plan on the spot. And the team would designate a follow-up slash aftercare team. So in the mobile type, you need to consider where the calls are coming from and where they're going. If this is going to be a community-led program, will they need to set up a call center? If this is going to be police-led, will the calls be routed through 911 or a local non-emergency line? And if this is going to be a service provider-led, do they already operate a hot or a warm line to receive calls? Also, in 2023, can people text? Can they DM over social media? Can they email requests? These are all things to consider. If the city is considering some sort of hybrid program, what is the process for, say, a police first responder to reach a service provider or a community responder as a second responder? The process for the calls being transferred and received is very important. The folks at Cambridge Heart are working with the LLC Karaya to develop the full infrastructure to be able to receive calls directly from the community, as well as transferred from service providers and government entities like 988 and 911. For the stationary response, the team is already out in the field. There are models that have teams in the field facilitating mutual aids, such as handing out socks, toothpaste, and food, or providing care, such as first aid, foot, and dental care. Some community-based organizations like Mental Health First and the Material Aid and Advocacy Program collaborate with programs to train community members to facilitate services for members of their own communities. They include street medic training and training to administer naloxone and other harm reduction techniques. So in the case of stationary mobile crisis response programs, they respond to incidents they encounter in the field. So perhaps they respond to a conflict that they witness, or perhaps the business owner would contact them to address an unhoused person who refuses to leave their establishment, for example. Once their responders receive a call among the field responders, they allocate a responding team to de-escalate the situation and create some sort of follow-up plan for short and long term. The mobile crisis.
I'm sorry. We have a question from
Oh, sure.
from a constituent. So if the mobile response team comes in to de-escalate a situation and the situation is violent with a weapon, how is that handled?
Yeah, exactly. Very good question. So there's a few things to consider before we can answer that question. So the type of weapon really matters, right? Because anything can be a weapon. A pencil can be a weapon, a book can be a weapon. So the type of weapon really matters. And so there needs to be consideration in developing the protocols for what is actually classified as a harmful weapon. And what kind of impact can a weapon make that would be considered harmful? So those discussions need to be had and protocols need to be developed. In general, we know that, for example, in London, general police officers don't carry guns. And because they don't carry guns, they answer a range of different services, calls, different types of calls without the use of a gun. And so that people can have any manner of a weapon, a tube, a book, even a knife, and it's responded to by the police that are unarmed. So there's no reason why a community responder needs to not answer a call just because it's classified as someone with a weapon. But that said, we live in America. If it's a type of weapon that has ammunition, like a gun, it's really critical to develop protocols to call in people who can deal with that and are trained to de-escalate that situation. In which case, it's really important to develop protocols for how to reach responders, police responders in particular, to address those specific types of situations. But I want to really distinguish between the different types of weapons. Does that make sense? And does it answer the question?
Thank you.
Okay, great question. Right. So the mobile crisis response model is designed for immediate response, exactly. So embedded in the model is a process for facilitating aftercare. And both for the stationary and the mobile models include a process for facilitating prevention services. So the mobile intervention allows people to call before they're in full crisis or conflict. The stationary model can include field access to services and resources that can cut down on long-term and more costly services, and act perhaps as an emergency room diversion, right? Who should facilitate the intervention? So a lot of the things I've named, police are already doing a version of, right? They do a version of the stationary approach. But again, this suggests that there are certain populations that are hard to reach for police to offer, for police officers. So if there's a population that isn't currently being reached by the existing system, perhaps we need to consider creating infrastructure that removes the police as the responders or the police as the facilitators and puts in a different type of responder so that you're able to reach the target population. The other models are training community members, right? So the non-police led models are training community members as community response teams. I am going to drop a link in the chat with some of the trainings that the HEART responders have received. So this model allows responses to a number of different types of calls. And you can see in the corner there some of the calls that you can answer. Great. Violence interruption models. Violence interruption models are so named because they seek to interrupt trends in violence. And there are a number of various violence interruption approaches and initiatives. There's the Cure Violence or Ceasefire, or the Violence Interrupters is an organization called Violence Interrupters. There's the Advanced Peace model. And there are a ton of different violence interruption models. Violence interruption as an approach.
Stephanie, I'm sorry. I'm gonna gently interrupt because we have a few questions from constituents that have popped up. I'll start with the one on mobile response teams since we just finished discussing those.
Yeah.
So the question from the constituent is, during what % of calls do mobile response teams need to call police for additional support?
Yeah, I mean, the best data that I have on this comes from Cahoots. I don't have it off the top of my head. But in 2021, they received, I can't remember exactly the amount, but over 10,000 calls and only had to request police backup for about 300. And I can fact check myself later to send that to you, Denise. But roughly that is what I recall. And in a great majority of the time, it wasn't because the responders, the responders themselves weren't in physical danger. It was usually to facilitate some sort of intervention that they didn't offer. So Cahoots doesn't do involuntary hospitalizations, for example. And so they need to call police officers to do restraint. So that if they had other options, for example, an organization that does do involuntary hospitalizations, that 300 number may even be less.
Would you say that it varies by program and year to year?
Across the board, we're really not seeing a lot of need for backup. Across the board, we're not seeing the mobile crisis response programs needing police backup. It really matters where the calls are coming from. So if the calls are being triaged from through 911, so the emergency communication dispatchers select which calls need to be allocated to an emergency response or a police response, as well as EMS and fire, of course. But in that model, they are designed to look for certain keywords. So if someone is saying, I need help, I'm looking for this, I'm looking for services, then in general, that doesn't typically really require a police response. It's just that the current model that we have has no other person to facilitate that. And so by by giving this option of a non-police response, then we can see that people who are calling for support don't really tend to need, the responders themselves don't tend to need the police backup.
This next question is relative to the very beginning part of your presentation. And the question is, are there good models from programs in other parts of the country that would help Somerville allocate resources across prevention, aftercare, and response?
Yeah, I mean, that's basically what we're talking about here. So I can't tell Somerville, here's what you should do. I'm not gonna, that's not what I'm doing here. I'm presenting some options for Somerville to consider, and some questions that folks in Somerville need to ask. So in general, it's good that you're asking this question of, like, how do we allocate the existing resources that we have to create an alternative across all 3 points of temporal intervention? That's a very good question, and it means that the fact that I've put this question here is something that matters to you. And I think as Somerville designs this process for creating its program, that is a question that needs to be answered by Somerville constituents.
And just so our Somerville constituents are aware, Stephanie will be available to our task force that is designing our PSFA, what emergency response models will be available in whatever version or model they see fit as far as doing the work that they're doing. So we are very appreciative to Stephanie for being one of the experts that is willing to work with and speak with our Public Safety for All task force. The last question, I'm going to leave it for last, a little bit last, because it's more of a overall question on all models, but I want to recognize that our constituent asked the question, and I'm not ignoring it. I'm just going to wait till you can introduce this model to ask it.
Okay. All right. Right. So violence interruption models. So as an approach, it seeks to keep up with discussions of violence within communities. It strategically locates violence interrupters in situations where violence might erupt to de-escalate and prevent the use of violence. This model also seeks to support communities after violence has occurred and proactively designs community cohesion initiatives to broker peace among users of violence. Organizations that facilitate elements of violence interrupter models include Mothers Out Front in Cambridge, Massachusetts, Mothers in Charge in Philadelphia, Pennsylvania. I wanted to name some women-led organizations to make sure that we're considering this. Right. The violence interrupter model begins by asking which community members commit violence. So when violence interrupter models may be designed to interrupt gang violence or youth violence or gun violence and domestic violence. I'll point out that domestic violence is often left out of the violence interruption framework. And I assume this is because it's often facilitated by fully autonomous organizations. And I added here because organizations like Mothers Out Front and Mothers in Charge identify all violence as violence. And activist and author Shira Hassan in Saving Our Lives, the book, identifies approaches employed by sex workers to address domestic and sexual violence against them. And creative intervention and other domestic violence organizations, sexual assault organizations, employ prevention approaches and extraction techniques to literally prevent and disrupt cycles of violence. So I include domestic violence in violence interruption models. Violence interruption models facilitated by quasi-non-governmental organizations, so nonprofits that are contracted by governments, and police-led initiatives tend to either employ a carrot or a stick approach to the intervention design. For example, the carrot-oriented initiatives may employ violence-adjacent community members as street workers or violence interrupters. And some people are critical of this approach because they essentially become informants or snitches. And these programs may pay gang or would-be gang-involved people to participate in pro-social programs. And I use the term pro-social here to mean positive or acceptable behavior. Some of the programs pay community members to train in conflict resolution and to prevent violence. The stick approaches attempt to identify users of violence, especially leaders in communities, to monitor and surveil potential users of violence, and also members of their networks. And these initiatives limit the participation of violence users in pro-social initiatives and prevent their access to community resources. I very much discourage Somerville from employing these approaches. The case study evidence shows that these types of violence interruption techniques don't work. When violence interruption initiatives are located in community spaces, emergency rooms, and or target community areas with high rates of violence that conflict that end in violence, how the intervention is designed and who facilitates the intervention matters greatly. When violence interruption initiatives are led by the police departments or police adjacent organization, the people who participate at best lose credibility among the hardest to reach populations, and at worst, they risk endangering themselves. So violence interruption models that employ both a carrot and stick approaches have low impacts and diminishing credibility among impacted populations and the people who study them. The reason for this is that they do not address the root causes of harm, and that the interventions are employed too late in the process to actually disrupt violence. But
Stephanie, I wanna ask one question that's specific to violence interruption.
sure.
And the question says that, you know, there are some existing groups that are involved in violence interruption. Is it helpful to centralize those, or is it better to have a distributed model with some degree of coordination?
Yeah, I mean, absolutely. So the hub model is an approach that requires an audit of existing resources in a community, and existing violence interruption models would need to be considered, right? So who is currently a community responder and what are they currently doing is an important question to ask. Does that answer the question?
I guess we'll find out from the constituent. We have another question, but again, that's a more generalized question, so I'll wait until we get a little bit closer to the end. I'm going to, it's 6:13 now, and our session ends at 6:30, so I'm going to assume that we'll probably need a part 2 so that we can continue this really great discussion. So I think, Stephanie, if we want to end with the violence interruption, and then I can ask the 2 generalized questions, that should bring us to 6:30, and then we can let our City of Somerville constituents know when our part 2 of this wonderful presentation that you have so thoughtfully put together for us will be.
All right, I'm nearly finished with the violence interruption model.
All right.
Right. So the violence interruption can be designed to intervene at any point in the temporal line. Some prevention approaches include gun collection, community circles, peacekeeping sessions. Immediate response initiatives include physically placing bodies between people committed to using violence, as well as conflict resolution and mutual aid. So getting people what they need when they need it is a powerful de-escalation tool. And of course, violence interruption can also be aftercare. Again, mutual aid is really important, access to long-term services, but it's also about having a plan for people to get what they need long-term. So that is all I have to say about violence interruption. Yeah.
Thank you. So I'll ask the 2 generalized questions that we received from our constituents. The first one says, can you comment on how to determine the size, or at least the initial size, of an alternative response program? And then there's another question attached to it, but I'll ask that once you're able to respond to that one.
Yeah, I mean, This is complicated to answer. So it depends on what you mean by size, and it depends on what the intervention needs to be. The next model that I was going to present was on targeted intervention. So basically, it's more about considering what needs to be done. I can quickly give some examples from it without going into it. So I've made like a non-exhaustive list of intervention types. I hope this is helpful. So when Somerville is thinking about its intervention, will the intervention be ending violence or addressing communication gaps between people, governments, and social services? Will it be facilitating peacekeeping, conflict resolution, and training folks in conflict resolution? Will it be coordinating safety planning? Will it help people navigate existing social systems? Will it help people disentangle complex situations and create safety plans? I lean into safety planning a lot. Will it generally address poverty? Will it attempt to increase civic participation? For example, voter registration. It includes helping people access proper forms. It includes the costs that come with receiving identification, as well as the time it takes, helping people complete those forms, learning about civic structures and so on. Will the intervention help by transporting people to doctor's appointments, court appointments, immigration appointments, or after-school programs? Will this program provide language justice? Will it provide translations to non-native English speakers? Will it address trauma? Will it do post-conflict support, for example? Will it do first aid and material and financial needs assistance? So just thinking about what the intervention actually will do is something that needs to be decided before you can think about scaling it.
And I appreciate your answer because, you know, for a lot of, you know, of people who are not day in and day out doing this work, it's difficult to see the complexities of answering what could be a simple question. And so, you know, I do appreciate your answer and how, you know, we want to be able to answer it in a simple way, but it's never going to be so simple. It's always going to be complex. And then, you know, the last question that we have is, you know, is the makeup of the city, whether it's small in geography or diverse or not so diverse, the suggestion is that if the city is smaller and not so diverse, there's something simpler that can be done in that particular city. How do these factors weigh in? How do these factors weigh on the choice of alternatives?
Yeah, I mean, my answer again is going to be, it depends on what the social problems are in Somerville. So what is this model going to do? What are the aims? What do you want it to accomplish? So that's a huge part of it before you can say anything about the program. And I don't think the size of any place matters. Somerville is not homogenous, not racially homogenous. So I don't think that's a factor. But it's really about what needs to be done. I've heard some ideas float around, specifically neighborhood targeted interventions, things in the Mystic projects, for example, things in Winter Hill. There are questions about getting services and take-up rates among immigrant populations. So making sure that the services that are already offered are accessible to the people who need them, and doing a better job at tracking that. So these are some of the ideas. And so I wanted to name those ideas, and then linking those to the idea of community safety. So how does people, I gave this example later in the slides about like youth violence, and a proposed intervention could be increasing take-up rates in you know, youth job programs, for example. So that's like a very narrow targeted intervention. And so I would really recommend doing a community process to learn more about what people want out of an alternative program in Somerville, and then designing a targeted intervention to address that specific issue, and then tracking your ability to see how well you are meeting the specific goal that the folks want out of the program.
Thank you. And so there's this very last question. What is the best way to collect data to determine the scope of the need?
Oh my gosh, yeah. I think I'm doing a whole presentation on key performance indicators. Right. So again, it matters what you're doing. So I really think that designing monitoring and evaluation plans need to be very specific to the program. And then we also need to think very strategically about who the intervention is targeting and whether or not they make contact with the agencies that already collect data. And if they don't, how do we get them to make contact, right? Because a lot of monitoring and evaluation plans measure quantitative data, and the quantitative data that they measure is contact, right? So when you go to your grocery store and you use your loyalty card, they're just seeing how many times you use that loyalty card, and they collect the data about what you're buying, of course. But we basically do the same thing for measuring the impact of take-up rates for different programs. So if someone goes to the YMCA or something, how many times a week does someone go to the YMCA? Like, that's the number of contacts that we're tracking. So if we design an intervention like youth violence and the take-up rates and youth jobs, how many times during the week did they miss their job, right? And so then we're looking at this week, it was 3 times they came in, and so 2 times out of 5 they didn't, and so on. And then we want to get more qualitative data about when they missed their job training or whatever. And then we create an intervention for meeting their needs for when they're missing their job training. And then we create and properly resource the intervention so that we get the data. Does the number of times they go in increase over time? Do they start going 4 or 5 times a week? And then we compare that to the old data. That's a very narrow example, but it's that granular when you're thinking about how to measure and monitor program successes.
Thank you, Stephanie. And that brings us to the close of the questions that we have from constituents. I want to thank you for your time tonight, and I definitely want to welcome you back so that we can continue the presentation that you have for us, and allow our constituents to ask you more questions. This is, again, a very important conversation for us to have as a city. And so it's important for us because of the complexity, because of wanting for our constituents to have a really good foundation and awareness and understanding of the work that we are doing, that we not even rush something like this, and we give our constituents an opportunity to ask you questions and to really hear from someone who has been studying this and has become an expert at these varying models. So I want to thank you, Stephanie, for joining us this evening, and I definitely welcome you back at some point this month so that we can finish off what we started. I want to thank all our City of Somerville constituents who joined us this evening to learn more about alternative response models. We will make sure to advertise the part 2 of this session. To learn more about the Public Safety for All informational series and view past sessions in this series, you can visit somervillema.gov/PSFA at our micropage and view past sessions that have already been gone live. And as always, we encourage everyone to visit us online on the somervillema.gov/RSJ or on Facebook and Twitter, as reflected on the screen. As you also know, we are having an ADA community outreach survey that is closing on Friday, June 30th. We have shared the link to the survey in the chat and also have the QR code visible on the screen. The survey is available in several languages, and it'll take you just a quick 5 minutes to complete. It will help inform the city's ADA transition plan update. Please, please, please share and fill out the ADA survey. Thank you, everyone, for joining us this evening. Stephanie, thank you so much for your time and your expertise. I look forward to our part 2 of this conversation on alternative response models. Have a good evening, everyone.